Hello, and welcome to the Interprofessional Patient-Centered Approach to Medication Management and Mental Health course. We're going to hit the ground running during our first class, so we've developed this presentation to review the course structure, expectations, and grading. There are 3 course managers for this class. I'm Katie Pincus. I'm a clinical ambulatory care pharmacist who practices at the University of Maryland Family Medicine Practice. Megan Arrett is an advanced practice pharmacist at Spring Grove State Hospital. And Erica Rosen is a licensed certified social worker clinical who practices at the University of Maryland Family Medicine Practice. Please email all 3 course managers with any course-related questions. Caring for patients with behavioral health disorders takes a team. We've each learned a lot from our colleagues from different professions during our careers. And we developed this course to allow students from the schools of pharmacy and social work to explore concepts related to patient care that affect both clinical pharmacy and clinical social work practices. You will work in small groups throughout the semester. Each group will include at least 1 pharmacy student and at least 1 social work student. If you have not done so already, check your group assignment posted on Blackboard. The definition of interprofessional education is when students from at least 2 different professions learn with, from, and about each other. You will collaborate in your groups to explore aspects of patient cases, develop presentations, and document your clinical activities. Ask questions. Don't worry if you don't know something. Maybe your teammates will, or maybe you'll figure out how to look it up together. We hope that this experience will prepare you not only to provide high-quality patient care to future patients and clients, but also to work collaboratively in interprofessional teams in a variety of settings. Since there are only 4 in-class sessions, there will be some work expected of you outside of class. For each class session, pre-readings will be posted on Blackboard. It is expected that you read these prior to class, as you will be applying this information to the cases during the class session. Additional references will be posted that may be helpful as you work through the cases. You're welcome to read or skim these as well. Each class will be 2 hours long. During the first hour, your group will work through the assigned patient case. The course managers will be on hand to help direct you and answer any questions you have. During the second hour, each group will present their case to the class, highlighting the key concepts. The presentation should be 10 minutes, and there will be 5 minutes for questions, answers, and discussion. After the class, you will work with your group to write a note, either in SOAP or SBAR format. SOAP stands for Subjective, Objective, Assessment, and Plan, and SBAR stands for Situation, Background, Assessment, and Recommendation. The case will specify which type of note you should write. This note is due 7 days after class, so the following Thursday. There will also be a short online quiz the week after the class session. These quizzes are on Blackboard and will be open for 24 hours, from 9 a.m. Thursday morning to 9 a.m. Friday morning. You may use references, including posted readings and notes during the quiz, but you may not discuss the questions or answers with classmates while the quiz window is open. In addition to grades for the patient presentations, written assignments, and quizzes, you'll receive points for attendance and from evaluation of your team members. As this class is entirely based on active participation, attendance is of utmost importance. Attendance points will be given for each class and are not able to be remediated for any reason, including excused absences. Students with more than 1 excused absence or an unexcused absence will be required to meet with the course managers to discuss the appropriate course of action. Group work is also a major component of this course. We will let you decide within your group the best way to divide workload fairly. At the end of the course, you will be evaluated by your group members on 4 domains: preparation, contribution, cooperation, and leadership or creativity. We are so excited to work with you in this class. Please reach out if you have any questions before the first day. Hello, welcome to the spring semester and to AST 6, 7, and 8. I am Katie Pincus, one of your course managers for this series. This brief presentation will review some key policies and procedures for AST 6, 7, and 8. The syllabus is posted on the school portal and includes many useful facts about the course, including the policies for grading, absences, and grade challenges. There are 3 course managers for this series. Drs. Dos Reis and Wang will manage exams throughout the semester. I will manage the cases and quizzes. All 3 of us also lecture in these courses. There will be 3 3-credit courses scheduled sequentially this semester. AST 6 focuses on endocrine disorders and women's health. This content will start with diabetes. The second exam will cover obesity, thyroid disorder, and contraception. Then we will move on to content on gender transitions, genitourinary conditions, and drug therapy in pregnancy. AST 7 covers psychiatric conditions, including depression, anxiety, dementia, bipolar, and psychotic disorders, as well as toxicology. AST 8 focuses on substance use disorders and neurology. The neurology content includes neuropathic pain, headaches, Parkinsonism, multiple sclerosis, and seizure disorder. Each AST course will have its own Blackboard site. In the course document section of Blackboard, there is a separate folder for each exam. All lecture slides and information posted by lecturers will be included in these folders. Also, the lectures are numbered in the course schedule. Note that the exam titles specify which lectures will be covered on each exam. There are some posted pre-recorded lectures, especially in AST 7 and 8. Check where they fall in the lecture sequence and ensure that you have viewed the lecture before any associated cases, quizzes, or exams. Each course will have a course liaison. This is the point person for general course-related issues. The course liaison also streamlines communication with the course instructors on content presented. If you have a question about instructions or content, it is very likely that other students have similar questions. It is best to funnel these questions through the course liaison to make sure the answers are also addressed to the entire class. If you have a more in-depth question for a course instructor, it may be appropriate to schedule a meeting with them during their office hours. Each instructor will share their contact information for this purpose. Direct questions about your individual performance in the course should be directed to course managers. It is best to copy all 3 course managers on communications so that we can best address your concern. This course covers pathophysiology, pharmacology, therapeutics, and clinical chemistry. These textbooks should be familiar to you from previous GPM and AST courses. By now, you should have received your copy of the prescription drug cards for the top 300 drugs. It is crucial for pharmacists to be familiar with pharmacology, pharmacokinetics, common dosing, formulations, contraindications, common and severe adverse effects, and special handling or administration instructions for commonly used medications. A table with the prescription drugs associated with each therapeutic topic in the course is posted on Blackboard. We encourage you to review the top 300 drug cards, your textbooks, or your other favorite drug information resource and complete the table for the medications listed. The information from the table is fair game for quiz and exam questions, even if it was not explicitly presented in the lecture material. 80% of the grade for each AST course will be determined by your performance on exams. There are 3 exams per semester. Exams are administered via ExamSoft. We will be consistent with all school-wide ExamSoft policies. These courses are fast-paced. Please pay attention to download windows and software updates. As course managers, we have tried to separate each exam by content area. This means there are small differences in the number of questions on each exam. We have done our best to keep these as consistent as possible, but there will be differences. For each course, you will have 1 hour and 20 minutes to complete exams 1 and 2. Each will account for 22% of the total course grade. Exam 3, which is the course final, will be longer at 1 hour and 50 minutes and will account for 36% of the total course grade. Any content covered in the course is fair game for the final. If you find an error on an exam question, you may submit an exam inquiry through ExamSoft. These are not an opportunity to justify, rationalize, or explain your answers. These are only to be used to bring attention to an issue with the question itself. The course managers also receive exam statistics and review both student and question performance. This allows us to identify scoring discrepancies. We rigorously review any discrepancies identified with the question author. Grades are typically posted within 48 hours of the exam, and the grades that are posted reflect this review and are considered final. The teaching assistant will schedule a time and secure a location for exam reviews. If you are interested in reviewing your exam responses and the correct answers, please schedule with the teaching assistant. Lisa Finn will coordinate exam reviews at the Shady Grove campus. Exam reviews are by appointment only, as the teaching assistants will only pull the exams for which a review has been scheduled. There are two types of cases in this AST series, instructor-led and small group cases. These will account for the remaining 20% of your total grade. These activities are intended to assess application of the content presented in the lectures. There are 3 instructor-led cases per AST course. Each active learning session may review content for multiple lectures. You will benefit most if you have reviewed these lectures prior to the active learning sessions. These are held synchronously at Baltimore and Shady Grove. There are 50-minute case-based sessions that require active participation, which may include cold calling or audience response technology. Each session will end with a short quiz, no more than 10 minutes in length, to assess understanding of the concepts covered. You will take the quiz on paper with a Scantron. You will be asked to move all of your belongings, including computers and notes, to the front of the room as the quiz is administered. These scores count for 10% of your total grade. There are 3 quizzes in each course, and we will count the top 2 scores. The lowest score will be dropped. There are not opportunities for makeups on these quizzes, even in the event of an excused absence. In the event of an excused absence, the score from that quiz will be dropped. There are 2 small group cases per AST course. Each counts for 5% of the total grade. You'll have 2 hours to work through the case in your small XY student group. These sessions are supervised by faculty and residents at both campuses. The role of the facilitators are to answer general questions about the content and provide guidance to your group, but they are not, of course, to answer the case questions for you. The group cases are mandatory, and all group members must participate. If there are repeated instances of individual members not contributing to the work of the group, we ask that you let the course managers know, and we will discuss with the individual. This is very important as it is part of the honor code in terms of participating with group projects. Contact Dr. Pincus if you have an excused absence for a case or a case closure session to discuss options for remediation. Individual understanding of case concepts will be assessed with brief quizzes at the start of each case closure. These will also be administered on paper with Scantrons. After each AST course is complete, we will calculate a final letter grade. You'll be able to see your progress in the Blackboard gradebook in the weighted average column. We adhere to the School of Pharmacy letter grading system, with A, B, C, and D's being passing scores, and scores less than 60% resulting in an F. The rounding policy states that scores will be rounded to the whole number, so a score of 89.5% will be rounded up to an A, 79.5% to a B, and so on. That is the only rounding or grade adjustment that is applied in this course. Our course will adhere to school-wide policies related to academic honesty. We encourage you to participate fairly in your group assignments, your quizzes, and your examinations. If you have any concerns about academic integrity in the course, please contact the course managers immediately so it can be addressed. As this is a spring semester course, there is the potential for weather-related issues. We will follow all campus announcements made both at Baltimore and Shady Grove campuses. There may be instances where we need to reschedule lectures or post previously recorded content. We hope to keep these distractions to a minimum. Look out for any announcements through the campus alert system, the Academic Affairs Office, and your course liaison. These are fast-paced courses that require hard work and dedication and time management. They also cover a number of interesting disease states where pharmacists play a dynamic role in patient care. We look forward to being your instructors in this process. Do not hesitate to contact us if you have any course-related issues. Best of luck in the spring semester. I look forward to seeing you in class soon.